Class or?
You can hear you if he's talking. Yes.
You're in what? What kind of class are you in?
You're in Allied Health.
Oh, all right.
Yep.
So you guys are interested in what kind of careers?
I got a gynecologist here.
All right.
You said OBGYN, OBGYN, and a veterinarian.
Nice. All right. So I had a little thing about nursing, but since you guys aren't interested in nursing, we don't have to go over that.
I think we should, just so they.
You think
know
you should?
Yeah, so they know the career ladder.
Okay.
Kind of know what their options are.
All right.
Okay.
Let me share.
Thank you.
You guys see that?
Yeah, they can see that.
Awesome. All right. There's my title at the moment. So a lot of letters behind my name, but so BSN is because I have my bachelor's in nursing, and then RNBC because I'm board certified. I have a certificate in evidence-based practice, and then I'm also an EMT. So that's kind of where I'm at the moment. History of nursing. And this isn't going to be some super boring brief. I think it sets up well kind of where nursing came from and where we're headed. But like back in medieval times, all medical care was men, and that was the way it was, but we didn't really know anything. We just chopped stuff off if it was bad and bled people. And then this lady, Florence Nightingale, came around during the Crimean War and said, hey, we need to open up windows. We need to get people walking and just generally treat them like human beings, and they do a lot better. They don't get so many nasty infections. They're happier, and happier non-infected people get better quicker. So then world wars, that we learned a lot about medicine because people got hurt a lot. And then in the 70s and 80s, nursing became kind of an independent profession. Today, it's the largest division of the medical field. There's like 2.9 million and 19 million worldwide. Here's kind of the chain of nursing. So if you guys become OBGYNs or oncologists, you're gonna be working with us, or this could be an option for you. So you start out like CNA, like I did, helping at the bedside. A lot of CNAs in nursing homes and whatnot. Some of you guys might be one. Then you can get a licensed practical nurse degree, and then if you become a registered nurse, you can start associates and go bachelor's and get your master's. Nurse practitioner has prescribing rights, and so you can treat patients. PhD would be the sciencey route to do research, and then DNP is getting your doctorate while being a nurse practitioner. So here's what my bachelor's program looked like. I went to Lake Superior State University in Michigan. And so that's just kind of an idea of, it looks like a lot, but I don't know, the semesters kind of go by and all of a sudden you graduate. So it's like 160 courses. We didn't have to claim a minor because 160 takes up 4 years pretty solidly. And then nursing responsibilities, you got to monitor your patient, and then doctors will order treatments, and then we prescribe them, but we also serve as an advocate. We're going to help them with daily living activities, so brushing the teeth and getting them walking, and then provide care and compassion. And then the point under that too, educate and translate. So oftentimes, if somebody does become a doctor, they've just spent the last like 12 years in school, and sometimes they're not the best at just communicating with human beings. And they also speak in a lot of medical jargon. And then sometimes it's the nurse who knows that medical jargon, but also can just speak plain English. And then that is the person that finally connects with the patient and spends 12 hours with them. And generally, that's the person that the patient really gets to know and trust. Here is some nursing specialties. So many options. So if you get bored in one, you can head to another. And people who work in the OR would hate to work where I work on a med-surg floor, and med-surg floor might hate to work somewhere else. So tons of options. And there's just some pictures of where I've come through my bachelor's program on the left, and then some Air Force stuff on the right. But all right. Do you guys have any questions about nursing specifically? Do you guys have any questions about nursing?
Can you kind of go back to where, and I'm sorry, they're trying to fill in as you're speaking. I have a
Oh,
guest
no worries.
now, so it's like you kind of went kind of fast. Um, is there any way you kind of go back and talk about what your occupation is and your job title and where you got your training from?
Sure. So I'll take you down my path of since graduating high school. So I graduated high school and I went straight into a bachelor's program, so a BSN, Bachelor's in the Science of Nursing. So a 4-year degree, and I came out of that as a nurse, and then I was going to try to be an ICU nurse at my local hospital in northern Michigan, but I didn't make it. So that was kind of frustrating. But then an opportunity came up in the Air Force, which was a lot more competitive, and I got that, but they wanted me to wait a few months. So I went and worked at a summer camp, which honestly was pretty interesting and fun. A lot of craziness, but I don't know, hand out meds, and I learned a lot. So I did that for a few months, and then and all during that time I'd worked as a nurse's aide on an orthopedic floor, so where you got patients who just had knee and hip surgery and whatnot, or trauma. And then I joined the Air Force and got trained to be an officer first and a nurse second. And then I've been working on a med-surg floor ever since. Well, through that time, I got board certified. So I took an extra exam to get the BC behind my name. And then I picked up my EMT license just because that's something I've always wanted. I like the emergency side of things. And then I'm evidence-based practice certified through Ohio State. Evidence-based practice is the idea that if we've shown a bunch of studies that show that there's a right way to do something, how can we change all of our hospitals to do that awesome thing rather than just always doing stuff because we've always done it that way? So I'm certified in helping that change. Yeah. What other questions do you guys have?
Yeah, you got to speak loud.
What kind of education did you need to do your occupation?
I can't hear you very well.
Say it again.
I said, what kind of education did you need to pursue your occupation?
So let me go back to this slide for nursing. So there is quite a range. I'm sure you guys during the summer could just get a certification, be a nurse's aide. So it would be the bottom line or the lowest level of the kind of the nursing pyramid. An LPN needs an associate degree, and it's kind of a long one. So generally you can't get it in just 2 years anymore. So maybe 2 or 3 for that associate's degree. If you get a ADN registered nurse, that third tier, an associate's degree, then you're a registered nurse, you got the higher level license, so you can work in an ICU. Some of the places an LPN can't. Then a bachelor's degree, that's where I'm at the moment. So you're still a registered nurse, but you have more education into leadership and into theory and into change. I'll also note that's where the country wants to head. So if you do get your associate's degree, most hospitals want you to get a bachelor's within 5 years. So if you end up wanting to go nursing, or you have friends that want to go nursing, and you maybe got some good scholarships in high school, or you just have been blessed with the ability to go straight to bachelor's, you can kind of skip a step later because you're kind of going to be forced to get it within 5 years anyway. But getting your associates first, then your bachelor's once you're already working as a nurse, not a bad idea. MSN, a lot of nursing leadership positions will require an MSN, and then you can work with just a master's, but then also get certified as a nurse practitioner. And then PhD would be getting your doctorate in the science of nursing. Doctorate nurse practitioner is kind of tied with PhD, but you've got a doctorate, but your specialty is being a nurse practitioner, less so in the science and studies. There's a roundabout answer to say pretty much every tier of education to be a nurse at different levels.
Any other questions?
If you guys don't have other questions about nursing, I can speak to what I know about the stuff you guys are interested in. So fire off whatever. I've worked with pretty much everything you guys listed.
What skills are needed for success?
I'm sorry, I can't hear you again. It's like really distant.
She said, what skills are needed for success?
Ooh. I was having this conversation with a new orientee of ours just the other day. She is so good at the bedside. Man, when she talks to her patients, they really listen. They have a good relationship. They care about each other. Or she cares for them, and they end up, you know, there's that good, awesome relationship. I can teach her how to be really good at knowing her medications and knowing her book knowledge, but I can't, it's very hard to teach somebody to care, to give a crap. And so I would really say through all of healthcare, just that spirit of caring and of putting your patient before your own needs. I mean, nurses and doctors both are kind of known for having that bladder, you know, you don't have to pee for 6 hours because you just get used to constantly putting your patient in front of your own needs. So caring would be number one. Number two, you genuinely need to have some smarts, and I say that just in the tier that's kind of in front of you. Medicine is a very educated career field, and so you got to care enough to try in your studies and learn, so you can be that translator for your patient. You know, doctor comes in and tells the patient, oh, you got increased lymphocytes and you got some hepatosplenomegaly, and the patient kind of is wide-eyed and goes, okay. The doctor says, do you have any questions? They don't even know what questions to ask. Okay, so you leave. Then the patient will look at the nurse and say, what the heck did they just say? Oh, lymphocytes are white blood cells, and also your liver and spleen are enlarged. That's what all those words meant. Oh, okay. And so that ability to have that education and also care and just be a human being and connect and talk about whatever. There's, you know, a wide variety of other little things that might make you a better nurse, but certainly caring, and then caring enough to study and get that knowledge is maybe the two biggest things. What other questions you got?
What is
the question was, what's a typical day like for you?
Oh, let's go to this page. Oh. So for me, I will we currently are on 6 to 6 shifts and on a Panama schedule. So I'm off today, which I really like. So I will work basically 7 out of 14 days. I work Monday, Tuesday, Friday, Saturday, Sunday. Then that second week, all I work is Wednesday, Thursday. And so every other week I get this 3-day weekend built into my schedule. But at the end of your 3 days on that weekend, you're pretty burnt because we work 12-hour shifts, and it turns into about 13 and a half by the time you get home or even leave the hospital. So I'll get there about 5. I have to be there in scrubs at 5:45 in the morning, and I'll take report. I can have as many as 5 patients. And then, so from that off-going shift, I took report on those 5 patients. And then I gotta figure out what's most important. So it's like this triage is a term we use in the ER to say like what's most important, or in medicine in general, triage, like what's going to kill my patient first, right? If I got a patient in room 2 that is bleeding profusely, and patient in room 3's got toe pain, I got to go see patient in, that's bleeding out first. And that's kind of an extreme example, but my whole day is these decisions of what's most important while not forgetting about those other 4. And so start out, and at some point in that first couple hours, I got to assess all my patients, talk to them, get to know them, put my hands on them so I can see, kind of how they're doing that day. And then also within those first couple hours, kind of the next step is to get them all their morning medications, kind of the big morning pass of the day. A lot of people in hospitals are over 70 on about 12 meds. So it's kind of the way that is. Then get that all charted somewhere throughout the rest of the day as things just come up. So at some point during that 8 o'clock-ish time, the doctors will have come by, and they're gonna, the role of the physician in a hospital is to kind of aim care and prescribe care. So let's say that the patient came in and their bowels weren't working, okay? No poop was going through, so they have a small bowel obstruction, be a common diagnosis. Day 1, we might put a tube in their nose to drain their stomach so they don't feel pukey. But day 2, maybe they don't need that anymore, or day 3, stuff started to move, so doctor comes and sees them that morning. Hey, you're doing better. Let's pull that tube out of your nose and let's try to start you on some clear liquids, water and Jello, and then we'll go from there. So he makes that call, and then I'll do those changes, pull that tube, get them their new diet, and then go about my day kind of after that assessment and morning med pass, giving other meds, doing other treatments, and just constantly reevaluating the situation, get myself some food at some point. And then I'll give report at 5:45 in the evening, and then generally get headed home by 6:30, 6:45, and then try to be a decent husband to my wife before I go to bed, and do it all again the next day. So, and I just say that to say that compassion fatigue is real. And so for 13 hours, you pour into other people and listen to their problems, and they're in like the worst days of their life, right? People don't go to the hospital on their best days, other than OBGYN. That's kind of a cool thing because people are there for some of their best days, but old sick people are not in their best days. And so you get pretty drained. And so, yeah, it's a balance, but that would be a brief-ish overview of a day in the life of a nurse. What else you got?
Do you plan on furthering your education other than having your BSN?
100%. So a lot of most nurses that get into the military are pretty driven to keep pushing it, both because there's military incentive and just that's kind of the person that joins. So I would like to get my DNP at some point, whether I stay in the Air Force or get out. I'm a nerd, so I love to learn, and I'd love at some point to be the person making the call. I like being a nurse and I like doing the orders, but I'd like to hit that point where, okay, with that small bowel obstruction example, hey, okay, pull out the NG tube today. You make that order. Also, in working with different professions, DNPs are some of the most rounded providers. So because they've been a nurse at the bedside, they really know how to talk to patients. And so sometimes a PA or a doctor, they just never really got those social skills. They just really got the brains. And but then you get this nurse practitioner who's kind of a combination of both. And that's not to say there's not amazing doctors who are awesome communicators, but yeah, working in a teaching hospital, that's definitely not always the case. And so I think being a doctorate nurse practitioner would be kind of my end goal. And I love to teach. Go be a professor is it's kind of a cool little niche and kind of a retirement job. But I plan to get my doctorate at some point would be the answer.
Okay. I got another question for you. How is it when you are a nurse and you're in the military? Do you serve basically like active duty because you work in the hospital setting, or do you have to be like reserved to do that?
Excellent question. And one that I did not know before I got in. So our primary mission, at least at Wright Pat, is mostly veterans. Most people in the military and their spouses are in their 20s and 30s, and 20 and 30-year-olds do not get sick very often. So while we care for some active duty, in general, we care for an awful lot of older people because older people are sick. And we take that mission, number one, to take care of our veterans, but number two, to keep my skills up. So if I was just training all day, my medical skills would not be great. And so it kind of is a twofold purpose there. Though my true purpose in the military is I have a number hooked to my name. And if that number gets punched, boom, I go down range. And that is very much all active duty. You know, I am leaving soon to go to Texas to go become an ICU nurse. And I hope my deployable function once I get there will be to fly in these flying hospitals. I actually have in this picture one here.
Maybe being like an air flight nurse then?
So that would be another goal I've had that I might do at some point, but that would be more of a paramedic. If you look at this bottom right corner, that is a C-17 aircraft. And so you can take up to 70, that's wrong, 50 patients, and the back 6 will be like an ICU. And so there's like there can be patients all up in the front of that thing. And then in the back, you have a CCAT team, critical care air transport, with a doctor, a nurse, and a respiratory therapist. And then you take care of the most critical patients. And that's what I want my job to be deployed is. I just think that's the coolest thing. So kind of care flight, but care flight's got one patient and it's very trauma focused. Critical care air transport is quite literally an ICU in the air. And so not so much the trauma, it's that trauma ICU patient who's already kind of settled. Yeah. Care flight though, that is like the pinnacle of nursing care. So like the DNP and stuff, you're working somewhere where you're ordering things, but by the time you're like a care flight nurse, you are at the zenith of like being able to give trauma care, and you're a paramedic typically, and an ICU type nurse. So especially in Michigan, there's a lot more options in Ohio. So you need a little less training, but like University of Michigan hospitals, you need to have 2 years on a burn unit, 2 years in pediatrics, 2 years in trauma. You have to be quite an experienced nurse to work in a helicopter there. Which was my roundabout tangent to say mostly veterans, but some active duty, and then deployed the active duty. So we take care of.
Well, I have another question. So would it be like a different rank or pay grade because you're a nurse in the service, like different than a regular officer, or not officer, or regular like cadet or something? Does the rank or pay change because you have the background or the educational background in medical? Your background.
Yeah, so we commission as officers, and then we'll climb the rank at the same pace that a civilian, or not a civilian, a line officer would do, like a pilot. I'm gonna go at the same amount of years to each rank as he would. I just have my specialty. He's got his. His is flying jets. Mine's being a nurse. That being said, if you commission with experience, they'll credit you half time. So like I've had some nurses I've worked with who maybe worked 3 years outside. So the Air Force will credit them 1.5 years. So the first rank you can hit is first lieutenant, your second lieutenant for 2 years, first lieutenant for 2 years. They'll only need 6 months to become first lieutenant because they spent 1.5 years, or they got credited 1.5 years from their civilian experience. If you commission as a doctor, you start at 03, the third tier, which is captain, which I don't know a ton about. I would assume it's quite similar in the other services, that they kind of credit that doctorate education with the rank of captain.
Wow.
The moment I commissioned, I made a little less than I had as a nurse on the outside. But within 3 short years, that's changed dramatically. So they financially treat you quite well. There's a lot of retention and incentive bonuses. Once you're in for a second, to kind of stick around. Oh, and let's not forget, like, full health care, right? So my wife is due 4th of July, and even if something goes crazy with that baby and it goes to the NICU, I will not owe a dime. Just like that's part of the gig. Heaven forbid I have a sick kid who needs a lot of medical care, that's taken care of. Like, that's part of, them. The military takes care of you, so you can worry about your mission, and the Air Force's mission, obviously. So that's like money that if you were on the outside, you made that money, you got taxed at 25%, and then you paid it for healthcare insurance or healthcare bills. I don't make it and then pay it. I just never had to pay it in the first place. So it's like, anyway, long story short, very significant benefit is the full TRICARE healthcare, among other things. So the whole officer thing does pretty well, nursing wise. Doctor wise, quite a deal for if you first do your residency with the military, because those student loans are for real as a doctor. And if you commit, I don't know exactly, but something like 6 years, those loans are taken care of. Because residency is kind of a bummer of a time if you become a doctor, because you're making like maybe 50 grand, but you have 200 grand in loans. You can barely make payments and put food on the table. And then you're like 30 years old by the time you kind of get rolling. If you commit some time to the military, that, like, time's cut out a little bit.
So,
Now, I was gonna ask, because I know one of our students is interested in veterinarian. Is that something that you can be in the services as well?
So there are veterinarians in the Army, and that we actually have a couple at Wright Pat, but they're Army. So we have vets primarily because we have military working dogs, just like police officers do. So those are like highly trained service members, those dogs. And so we need vets who can care for them. And it's actually pretty cool. I've been to a couple of trauma courses, and we talk about, I'm a nurse. I don't know hardly anything about animals, but I know some dog protocols because we want to keep them alive. It's like a big asset to the military, and they save a ton of lives by being awesome dogs. And so that is where a vet can be active duty. Yeah.
that's good. Now, let me ask you this. All right, so say our students, they're finished here. These are juniors, they finish next year, but they want to enlist. So they're finishing here with their diploma, and then end up having their state tested nursing assistant certification. Do they go directly into basic training, and then what would happen for the next point for them if they wanted to continue their education after they finish their basic training, but they wanted to still be in the military, how would that benefit them?
So, that isn't the path I took, although some do. So what I did is go get my degree and then commission into the military as an officer. If you enlist straight out of high school, like my brother's going to do in a couple months, you are E1 enlisted, and you might get to go medical and then be a medical technician, which is pretty cool. Do some pretty cool jobs, but you're not going to be a nurse right away. But currently, the Air Force at least does a nurse enlisted commissioning program, NECP, and so some of our best nurses are those who did enlist, then did that program, and then the Air Force paid for them to go to school for 2 years while they got their nursing degree, then they commission as an officer. So that is an option, but it's up to you.
Okay. We have a question.
What advice do you recommend, like, for us going into the medical field?
Say that one more time.
What advice do you recommend for us going into the medical field?
Into the medical field? Sorry. I would just say broadly answering into the medical field question is just don't forget that you're caring about your patients at the end of the day. Some people get burned out during school, or maybe they just don't want to try that hard during school, and it's kind of bigger than you just wanting to go to school. Like, I mean, in high school, there were some classes I didn't care about, and frankly, I don't even regret not caring about them that much. But once you get to college and you're like studying human anatomy, or this class you guys are in right now to, learn some medical stuff, like that's real. That's stuff that, I don't know, like because I learned my stuff really good, I can give better care to my patients. I can protect somebody. I can save somebody's life because I learned my stuff so well. So just not forgetting the goal, which is to provide awesome care for your patients and help people. I think in this world where technology has such a presence, and COVID has us all separated, and all that today is, like, caring for somebody is the most real thing that I do on a daily basis. Like, it's so real. I mean, like, I go in the morning, and like I said earlier, it's the worst day of these patients' lives. Or if they're giving birth, maybe not so much, but they're still going through a crappy situation. Like, it's going to be painful. And the ability to, like I said earlier too, I'm a nerd. So my whole thing is I do a decent job explaining where they're at. I can take those big jargon words, cut them down so they're like, okay, I finally get it. And it's so rewarding. Like, that patient sat there for 3 days not understanding what was going on, and I got to be the person to finally make them feel safe. Or, like, it's not normal to have somebody else wipe your butt, right? That's a common nursing thing. But if I can do that in a way that just still makes them feel human and makes them feel better, and then I see them walk out of the hospital, like, I'm also a chemo certified nurse. And so I've watched chemo do some awesome things in the past year. Like, I thought this one guy was going to die one night, but he kind of hung on. And then that was the first day he got chemo. So that chemo went in, and they gave him such a strong dose. All his cells were like dying because we wanted to kill the cancer too. And he pulled out of it. And then he spent like basically half of his life over the next 4 months in our hospital getting chemo 24/7 while he was there. And he got a clear PET scan like 6 months later. PET scan is you can see if the blood vessels are feeding a cancer tumor. And now he's just living life again and happy. And yeah, don't forget what it's all about, and that's caring for the patient who needs you. So that's my biggest thing of advice there.
So it's definitely important for our students to know their medical terminology and have a strong understanding of anatomy and physiology.
Oh, yeah, I see what you're doing there. But I truly, I tutored anatomy. So I took anatomy, did pretty good. So I tutored it. So I got paid to keep talking about anatomy during my other 3 years of school. And knowing my anatomy super well made it so that when we got into pathophysiology, that all came easier because I didn't have to relearn anatomy every step of the way. So it'll help you critically think through questions if you know your basics. And so truly it does matter, even though it's annoying. Flashcards is that was my trick. Is it just the anatomy straight memorization? But once you have that knowledge, you can apply it to the plethora of, pathophysiology, pharmacology, all the ways we deal with that anatomy. So it does matter.
Okay, so if you was to like enlist in the military to be a veterinarian, like before you graduate high school, would you still have to like, don't you need like an education of it before going into like enlisting?
Yes. So maybe I don't know the veterinarian path perfectly, or really honestly that great, but like for example, with our medical doctors, they will, there is a path to enlist, but typically they're going to go get their education and then come join the military. And I would assume veterinarians is similar. There is some programs where you can enlist right out of high school and then go get your education. Like I said, there's nursing. You can go do it as a doctor. Those options are there. Far more commonly, you're going to see somebody get their education, then come join, and kind of talk to a recruiter maybe in school. And that's where you kind of talk about like, hey, they'll cover your loans if you join, and you might go to training like during medical school, like during one of those breaks, or veterinarian school if they do that with that. And then you join the Air Force once you graduate and have your actual license behind your name. I would guess that's more what it is. Though you can definitely enlist and then get your training later, which is super awesome because then you're going to school while getting, you're a full-blown active duty officer or enlisted, but you're going to school. So the people who did those enlisting commissioning programs, they spend like 2 years of their life active duty, getting treated active duty, but their whole job in life is to do well in school and get over a 3.0. So it's pretty neat too.
What's the hardest obstacle you faced like so far?
Say that one more time. The hardest what I faced?
Obstacle.
Oh, obstacle. I guess I could answer that in a general medical way. I think learning, no, I can do that for where I've come and generally medically. I think communicating with humans, that sounds funny, but is one of the hardest arts to learn. And I precept a lot of new nurses, and this comes up more often than not. Like how do you go into a conversation with somebody you've never met, clearly express your expectations and what you want to accomplish with that conversation while not being like a robot, and then come away from it where they feel heard, you feel heard, you feel like you got your point across, and everybody's like happy. Like that is such an art. Like how do you connect with people that okay, so I'm from like farming northern Michigan, but in the military, everybody's from everywhere. People from Georgia, people from California, people from inside of cities that have never seen a farm. I grew up milking cows. How do we all talk? And so just learning how to find some common ground with everybody. And I think like it so exists. We just, again, just the way the world kind of is right now, and COVID, and I feel like people don't know a lot of people that's not who they kind of grew up with, but there's generally a lot of common ground. Like everything's so politicized, everybody is like, oh, my political candidate or my view on this, but really we're all human beings and we all generally care about a lot of the same stuff. and just learning to find that common ground, laugh with each other, have that small talk, and then, oh, this patient I never met, let's have this small talk. Here's what I want to do with your day as your medical person. And if you can come away with that and they're like, man, I made a connection. That's a cool dude. He's not mean. And he also knows what he's doing. If you can have that conversation and have that result, that then you've kind of made it. So the hardest obstacle is being a good communicator with all sorts of people. And it takes years of practice, but you got to practice too. I mean, you can practice by talking to your waiter or waitress that's going out to eat, or you can practice talking to strangers on the street, but it just takes years and you come around to it. But what else you got?
Okay, where do you see yourself in like 5 years, and what do you think you got to do to get there?
Good question. Well, I've got quite a decision coming up in my military career. I've been very blessed to do very well so far. So if I want to stay in, it's very much an option. I can kind of, if I stay in, I will be applying to a program where they might pay for my doctorate, my DNP, which would be super awesome. We'll see if it happens. Pretty competitive program. Like I said, my wife is due, so with our first child on the 4th of July, if having kids is just not working for her, my family is more important, or is my first priority, even though I like the military a lot. Then I'd probably get out and probably try to go be a flight nurse, like Care Flight, like Aeromed, like Mobile Care in Cincinnati. So I will either if I get out, I'd go that flight nursing route and get my paramedic, because I still think that's so cool, flying around on a helicopter to go be a nurse, and that's like the top line for me. And if I stay in, I'll probably try to get my doctorate. So, and what I need to do to get there, just keep doing my best every day. I don't know how to. A little more education, obviously, on the one hand, and on the other hand, just kind of setting myself up with the right, again, certifications and communicating with human beings to know the right people to get on one of those helicopters. So my 2 options for 5 years from now.
Do we have any other questions?
Is all parts of the military like dangerous? Because when I think of like military, I just think of like people dying.
Say the first part again.
I said, is all parts of being in the military dangerous?
No. So there are, so I guess I say no, kind of tongue in cheek, because we haven't been in a major power conflict since World War II. But there's like 2 million people in the military, and we lose some people occasionally who are like frontline troops overseas, right? And so it's not just like when you join, you are saying, hey, I realize there are risks associated, like the job I kind of want next, I'm going to go be in an airplane that has Air Force symbols on the side. I know that could get shot down. I know it's dangerous to be in an aircraft. I'm willing to give my life if I have to for my country. That is something you have to say. That being said, it is not World War II anymore, and there's quite a difference between joining the Army infantry and being a nurse in Dayton, Ohio. Now, I can go get deployed over there, but as a medical person, you're typically going to kind of be back a bit, unless you want to be very forward, which is pretty specialized. Like we have surgical special ops teams that support very forward special ops, but that's a very elite group, and you have to very much try to get there. They're not just going to throw you there. My brother is doing delayed enlistment, so he is a senior right now, in Michigan, and he already has been given the job of sensor operator. So he's going to be a camera operator on drones, and he's probably going to be at a base in South Carolina flying drone or being part of the drone mission overseas. So the answer is no. I'm not scared to go to work every day in Dayton, Ohio. So kind of that.
Anybody have any more questions? Any questions?
You guys talked, it seemed like a lot of you wanted to maybe go the doctor route. So do you kind of understand the educational pathway there?
Yeah.
That's been kind of explained. Yeah, you feel like you understand.
All right, so let me ask you one question before we get out of here. Let's see. So do you recommend one part of the service versus another? Because I know you said you're Air Force. So would you recommend the Air Force over maybe the Navy, the Marines, or the Army?
That's a good.
So I can't give a super, I mean, my answer is going to be very biased, but I will say this. Well, I'll try to not screw up this story that honestly really encapsulates it. And maybe you guys have heard this before, but you know, there's guys from every different branch stationed stationed somewhere. And there's a Marine who's like, oh, there's a scorpion in my tent. And he takes his boot, he smashes that scorpion, in his tent. And then there's an Army guy and he sees a scorpion in his tent and he gets kind of scared of it. He goes away. The Navy guy's like, oh, there's a scorpion in my ship or something. And he kind of goes away from it. The Air Force guy's like, what's a scorpion doing in my hotel room? And the Air Force just is known for treating its people. Again, this is going to be filled with bias, but you can talk to people from all different branches, and they generally agree that the Air Force treats its people maybe a little better than the other branches. Keeping families together. We do mostly 6-month deployments. Marines do a year deployments. I mean, I want to keep my marriage healthy. A year deployment, that's tough. I could do it. My wife could handle it, but it would be hard for me to sign up knowing that that's a part of the gig. Also, Marines are straight Marines. So there are no nurses, there are no medics. There are no medics in the Marine Corps. Marine Corps are straight infantry. The Navy supplies them with medical people. And so there's really just 3 options for military nurses or main military medical, and that's Army, Navy, Air Force. And they kind of have different missions. You want to go sail around on ships? Pretty cool mission. But a lot of them are on land. And to be a nurse, you have to have 2 years experience first. So only the Army and Air Force will take brand new nurses, and maybe brand new doctors as well. Army's gonna have more tent missions, if you will, or deployed type missions. But in general, probably gonna be fairly similar. Of the 3 main medical branches, Army's going to have probably the hardest PT test, if that matters to you. Probably going to be the most strict. Navy and Air Force going to be a little more loose. I'd rather fly in an airplane than be on a ship, so that's some of my incentive too. But.
I got another question. As to what you were saying, if a person took the AFRL test and their heart was set to going to the Air Force versus the other areas of service, what do they do in that instance? They say, well, oh, you didn't score such and such score, so you can go to one of the others. How does that work? Do they ask them to maybe take it again to see if they score higher?
Yeah, if you it's a pretty narrow cusp that people would because the cutoffs between Marines, the lowest that a Marine would take and the lowest the Air Force would take, it kind of gets overstated. It's only about a 10-point difference. But if you're in that little 10-pointer, yeah, you could. I think you can retake it. I think that's the thing. Otherwise, yeah, I guess you'll just have to kind of pick between your options. It really comes down to like what kind of mission you want to be a part of. Do you want to, especially enlisting, do you want to go be on a ship for a bunch of months, or do you want to go, be more of a ground mission? Or Air Forces, frankly, we got bigger bases because our mission is to operate aircraft. And so, it might take 2,000 people to put one aircraft in the air, because I'm taking care of, in the hospital, taking care of the people who get the plane ready and the pilot, and the pilot and the plane ready people, they get the aircraft in the air, and the aircraft costs 20 million, whereas the Army might be sending 20 people out per however many people are back at base. So we have bigger bases. Maybe there's a little more emphasis on taking care of the people and their families, but I haven't been a part of those other branches, so I can't totally speak to it.
So let me ask you this. So you lived in Dayton, right? That was your home state, for instance. Well, Ohio. And you wanted to be at Wright Pat. Is it likely that you will be able to stay in your state and maybe be stationed at Wright Pat?
It's probably a decent chance if you get a job that we have. So if you want to go medical and you get that job, Wright Pat isn't super common for people to request. People want to go south. They want to be in Florida. They want to be in California. Not a ton of people put Wright Pat at the top of their wish list. I did because I'm from Michigan, but often people, if they put it number one, there's a decent chance. Now, you enlisted, you might be able to stay there quite a while. Officer, you're going to move no longer than 4 years later. So I've been here 3 years now, and I'm leaving in May. So for Texas, and then might come back someday, but not for at least a couple more assignments. So, but there are people who spent whole careers at one base if they're enlisted, and then you have to that has to be your priority, because you're not going to be able to climb the ladder by staying in the same place. You're not going to be able to get a huge breadth of experience by never leaving the same base.
Oh, okay. Well, that's some good information, because I have a daughter that's a senior that wants to go to the Air Force.
Yeah.
So she's in biotech right now as her career tech pathway. So that's why I asked all the probing questions to see, what would be some good options for her.
Did she do delayed enlistment, or is she just gonna enlist when she graduates?
She wants to do the basic training over the summer. She'll be 17.
Right. Has she talked to a recruiter already, or what's the?
Talked to somebody, they told her that she had to wait till she turned 17 for them.
Oh, she's not 17 yet. Oh,
she'll be 17.
That'll do it. So
junior year, she's going to be a senior next year. So.
Oh, I gotcha. Oh, got it. She's still a junior. Okay. Yeah. So she could do what my brother did, talk to a recruiter, and then have a better chance of getting the job she wants, which is honestly generally the biggest thing. And so, especially with good ASVAB, she might be able to get the job she wants better by doing delayed enlistment and talking to somebody when she turns 17, and then when she goes that summer after she graduates, she kind of knows her job already, versus if you just go open general, they call it, and you just say, hey, I'm joining the Air Force, give me a job. You kind of get whatever job, maybe like security forces or kind of whatever. So she might have a better chance to get the job she wants, like my brother did, if she talks to him as a senior in high school versus wait until she graduates, then talking to somebody.
Okay. Well, thank you for that information. I do appreciate that.
Yeah.
Further questions?
All right. Well, thank you. I really appreciate your time today. I think we learned a lot.
I know I did.
Yeah, we learned a great deal.
So we thank you so much for this opportunity and your time. We do appreciate that.
No problem. If you guys think of a random question, you guys can route it up, and Ms. Brown, I'm assuming, can kind of get it to me, and I'd answer whatever questions you guys got. So pleasure speaking with you, and thank you guys for your time.
Thank you.
Thanks, everyone.
Yeah.
All right, ladies. Wealth of information.